Hi, I'm Ben Edwards. I'm the managing partner on the Schoppee Farm. Welcome back to the Schoppee Farm Show. This is a quick follow-up addition to the previous conversation with Dr. Rioux. We received a bunch of questions. I want to cover them two or three at a time. So we're going to get the first three with this video. The first one is about essential workers returning home from business trips and some considerations before they or as they are reintroduced to their family. The next couple are about CBD and how he might utilize CBD with patients, and also ways he might talk to someone who's interested in CBD. So if you're interested in CBD or you're interested in how a physician may utilize CBD with some patients, give it a watch. There's links below directly to the independent sections of the video in case you don't want to watch the whole thing. I think that's it. Thank you very much for watching, and without further ado, here is Dr. Rioux. All right, Dr. Rioux, welcome back.
Well, thanks. It's been good seeing you.
It's good to see you too. Thank you for taking a little bit of time out of a Sunday afternoon to answer a few follow-up questions. We're going to do this kind of quick and maybe in some bits and pieces. So we're just going to hit three quick questions today so we can all get back to getting ready for this late April snowstorm, which is
Yes.
tonight, which is great. So my first question, we get these, it's actually a copy of we get this a lot, but I'm going to use one particular example just so it's easy to talk about. So we have a dear friend of the family who's a merchant marine, like my brother was before we talked him into being a farmer. And he works on an oil rig, 30 days on, 30 days off. He's obviously in contact with a lot of people when he's on the rig, and then in the process of coming home, it's multiple trips, multiple layovers. So there's a lot of exposure, and he has a wife and a child, and he only has 30 days off. And of course, a couple of those are travel days. So he only ends up with like 28 days or so home. The idea of quarantining for 14 of them is obviously pretty unattractive. So he was wondering, can he just get tested? If he can't, like what would your guidance be for this particular situation, which I think would be pretty applicable to lots of essential workers that have to travel and then come home to a family that doesn't have that same exposure?
Right. I guess I would have to say that he's not that different from a healthcare worker who gets exposed every day. And obviously healthcare workers are wearing PPE, and they're able to come home and, they strip down and they wash and they shower and they make sure those clothes stay, not, come in contact with their family, and they're able to interact with their family. Obviously, we wear the PPE when we're exposed to people with the disease. Obviously, he doesn't know if he's come in contact. If he's traveling, he doesn't know if he's come in contact with people like on the airplane or obviously, I think there are not many people on airplanes anymore. And so you probably can social distance. Wearing a mask, if he could, he should wear a mask anyway in public. But if he was going to wear a mask, if he could get an N95, that probably would be more helpful. And I would say that, when he got home, if he monitored his temperature, monitored for symptoms, and basically just watched those things, he probably would be okay. The hard rule is probably he should quarantine, but that's probably going to be very difficult to do in his case. If he's at all symptomatic, then yes, he should be tested. Unfortunately, we're still not any better than the last time we spoke about testing. It's really pretty dismal as far as testing goes right now.
Oh, that's too bad.
Unfortunately, we can't test. Yeah, it would be best if he came and got tested, and we had the test available, and he tested and he was negative. He would have a little bit more reassurance. We're seeing a lot of reports about asymptomatic people still passing on the disease. So, if his family members are not at terribly increased risk. Um, if they don't have significant illnesses, then he probably is safe just to do what healthcare workers do every day when they go home.
Okay. So just kind of watch your temperature, watch for symptoms.
Right.
And that's really the best that he can do. He can't just come home and get tested and know. Just kind of has to.
I wish that was the case, but we don't have that available. They're not. I mean, if you could get the test, we could do the test. It's just that the labs are not running them unless they're in a high risk category.
Right. So if he's generally healthy, he's not going to be able to get the test. Just come home, watch his temperature, as long as the family members that he's going to be in close proximity with are not at increased risk. So if they are also relatively young and relatively healthy, just do what you guys do.
Yeah, I mean, that's the reality of what we do. I mean, obviously, we can't isolate healthcare workers from their families, and we can't isolate essential workers from their families either. And so,
Okay, real quick, we didn't even get this video up, and we're already getting questions to the people we showed it to. So my wife and I were quarantined. Dr. Rioux recommended that my wife and I quarantine after we returned home. And the questions are, so why would Dr. Rioux recommend that our friend not have to quarantine, and whereas we did? And I think that the short answer here is, and I should have asked Dr. Rioux this, but it skipped my mind at the time of the interview. The short answer is it's a case-by-case judgment call. And this is why you really need to talk to your doctor. So in the particular instance with Allison and I, we had come from an area with a rapidly increasing infection rate. So we had just left the Lombardy region of Italy. And in the intervening couple of days where we left Italy and tried to get home, the case numbers had gotten much, much worse in Italy. And we also had to take multiple trains. We passed through another area that all of a sudden, a day after we left, announced a rapid increase in cases. So the likelihood that we had been exposed was pretty high. And then, of course, we had to travel. And at that point, the end of February, the travel system had not made any adjustments yet. So there was no social distancing. We were right on top of everybody. The surfaces were not being cleaned like they are right now. So the overall likelihood of our exposure was much higher than, say, our friend traveling home now, where airplanes are relatively empty. Everyone is aware of the issue. A lot more people are wearing masks. So again, this is why you really need to talk to your personal doctor who knows your individual situation. Okay, that's it. Okay. So two more quick questions here.
okay.
Or really, they're kind of two of the same. So we get a lot of questions from clients and potential clients about starting CBD within a routine. Of course, I talked about this in a previous video. You don't need a prescription for CBD. How, in general, do you talk to your patients if they're interested in starting CBD? Like, can you talk me through what a normal conversation might be like?
Yeah. It's actually, I do a lot of recommendations for CBD in a lot of my patients. And probably the most common recommendation I have is for elderly patients with arthritis pain who have other comorbid states. So the best arthritis medications that are out there are non-steroidal anti-inflammatory drugs like ibuprofen, Nuprin, Advil, Aleve, those kind of medications. And they work very effectively as an anti-inflammatory and help with arthritis pain. But the unfortunate thing is, as you age, non-steroidal anti-inflammatories are not that great for people who have kidney disease or heart disease. And so we ask them not to take it. And so it's really a stickler for elderly patients who are having significant arthritic pain. And so I recommend CBD for those patients to see how it works. And surprisingly, it has a very good, not surprisingly, but it has a very good anti-inflammatory effect. And patients do get benefit from it. To give you an example, I have had about a 66-year-old guy who is pretty active, but has terrible knees. And his arthritis was significant, and he probably is really close to having knee replacements, but he has been putting it off and using ibuprofen. Unfortunately, he has diabetes and hypertension, and his kidneys, hypertension and diabetes affect the kidneys, and that's what we try to protect. And so his kidneys were starting to be affected by his diabetes and his hypertension. And I said, this ibuprofen is not going to be good for you. And you should stop that. And he tried using CBD cream. And depending on what you can get, and I saw him back for his regular diabetes checkup about 3 months later. And he said he started using the cream twice a day. And before, even when he was using the ibuprofen, he would get out of his car or truck and have to stand there and wait for his knees to stop aching, and then gradually warm up and move. And every time he got up from a sitting position, he had to watch himself, as far as being able to ambulate. And then after about a week or so of using the CBD, he would, get up out of his chair and walk across the floor, and not think about it. And he was like, wow, this stuff is working. And so he was using it twice a day, rubbing it on his knees. And then he went to, once a day. And then he uses it like every, 3 times a week. And he said he's fine. And last time we talked, he said, I've scheduled this, it was a couple of months ago. He said, I've scheduled a skiing vacation. That's something he wouldn't have done. So that was a pretty good story. So I use it a lot for arthritis pain. And I also have used it for sleep and anxiety. And patients who have used medical marijuana and don't like the psychoactive effect of THC, I have gotten them to use CBD, and they seem to think that it's the same effect. And the other, obviously I've used it in cancer patients because that for the anti-nausea effect and for the anti-anxiety effect, and it also helps with pain, and that's been effective. And I used it. One case that surprised me the most was this one guy who was 62, 63 years old, very active lobster fisherman, and has been lobster fishing his whole life. And he also has some medical issues with abdominal pain from another disease and from multiple surgeries. And he'd been going through surgery after surgery to try to fix it. And he wasn't very successful, and it was still hurting. And, finally he came in to me and said, I am really tired of this pain, and I need something for the pain. And I said, why don't we do this for 1 month? Why don't you try to get some CBD? And I want you to take it. I can't remember what I told him. I think I said 25 milligrams twice a day, or 30 milligrams twice a day. And I said, I'll see you back in a month. And if that doesn't work, then we'll talk about a pain medicine. And he came back in a month, and I was expecting, he's going to get a little bit of improvement. But he came back and he was like, this stuff is amazing. He said, I'm not in any pain at all, and I don't need the pain medicine, and I'm going to fish, and I don't need to go on disability. And it was like, wow, this was a great story, Yeah. So I get stories like that. I've had other patients too that come in and say, it didn't really work for me. So
I think there is. I mean, certainly from my experience myself and with working with other people with it, there's a there's a learning curve about what to take and how much to take and how often to take it. It's not quite maybe as simple as just taking a couple Tylenol and you feel better. Like there's a definite learning curve. There has been for me for using it for my anxiety. I didn't. It took me a while to slowly build up to a dose that worked and figure out when during the day was the right time to take it. I mean, it takes a little bit of, at least for me, it took a bit of patience to sort out what was the best way. But so if you have a client that comes in and they're interested to start CBD, how how would you advise that they do that? Like, I guess it's going to depend on what they're trying to accomplish with it. But in general terms, is there anything in particular that they should watch out for, or common ways to start, things like that? Can you talk to that a little bit?
Right. Like in all of these medication and medications that I prescribe, you want to start at the lowest effective dose. And so unfortunately, we don't have very much guideline for dosing CBD. And so the only dosing guideline is in CBD treated children for seizure disorder. And so it's a really small dose. It's like 6 milligrams twice a day or something like that. And so it's usually not effective for patients who are trying to treat pain or anxiety. And so I recommend maybe trying 20 milligrams once a day, if you or 30 milligrams, whatever you can get. The other thing is, sourcing it has been always a problem for patients, because a lot of times they bring me in bottles and there's not even milligrams on it, and they're so they're not buying good quality, or something that we can dose
Right.
appropriately.
Well, it's certainly, I mean, it
So
really isn't regulated. It's unless you have actual testing results published along with the information, it's hard to trust what's even on the labels. It's tricky. And I know that
that's true.
that's where I started. I started with 20 milligrams and it didn't seem to do much. I'm at like 80 to 100 milligrams a day now, depending on how much of a pre-roll I smoke. And like, I mean, I weigh 215 pounds or something like that, but that's about what works for me. And I see people from all the way down to 20 milligrams having great success. And then I know people that take 300 milligrams. So it's all over the place. I can't see as there's any problem taking more yet. It seems fine.
Right. It's an effect. It's an effect thing. And I would say that the gentleman who is treating this pain, I think he's at 60 milligrams a day, and he's fine with that. The gentleman is using the cream on his knees. It's kind of hard to say what that dose was. We use things like Aspercream and nonsteroidal creams to put on joints for relief, and that works. And so I think the CBD would probably have a similar effect. Cool. Especially after I heard the guy wanted to go skiing after he rubbed it on his knees. I was like, okay, this is probably going to work.
That's a pretty great story. Well, let's wrap up with that. I want to kind of keep this one shorter. Any other thoughts, or you good?
No, I'm good.
Okay. Good.
I can't wait to get more people using Schoppee Farm products, and you obviously are getting more on your store. And
yeah, we're starting to make a little progress. I'm very excited about it.
Yeah, and obviously it's a good product. You're labeling it well, and if we can do more dose related studies on that and seeing how we can do it. I like the oils and being able to tell patients, you take a dropper that's 20 milligrams, and it makes it easier for them to dose it.
Yeah.
Smoking is a little bit different and obviously absorbed a lot quicker, and
Right.
so it's definitely an effect kind of thing. So,
Yeah.
and it's hard for doctors to recommend smoking.
Yeah, of course. I hate to admit that, like, the pre-rolls are definitely my favorite. I love I love the experience of it. It works quickly. It feels great. And the oils are less fun, but obviously it's not smoking. But anyway, I'm going to shut up before I get in too much trouble here. Thank you very much, Dr. Rioux, for taking the time to talk to me on a Sunday. I really appreciate it.
Thank you. Enjoyed being here.
All right. All right.